okay? And we're gonna target acne and eye contour. In case of we have time, otherwise my colleagues from Global Med, the official distributor here from Institute BCN, the brand that I'm going to touch up a little bit for you to have a big picture of the laboratory. They are going to keep on having with you the rest of the evening, okay, and probably be able to perform the third demo, which would be for the pigmentation, okay. The main subject for today, because of short time, I wanted to cover up a little bit the main aesthetic concerns that you normally are dealing with in your clinical offices or your spas or beauty salons, okay? But let's talk a little bit about Institute BCN. This is a company, a Spanish company that is located in Barcelona. So, by the way, yesterday there was the big match. I don't know if you're fans from football, but Barcelona. Okay, there's one here. So there we are. Okay, just where the team, soccer team, comes from. Okay, and this is a pharmaceutical laboratory that for 13 years is producing mesoceuticals, so sterile ampoules and vials, sterile ingredients for you to be able to treat the main aesthetic concerns, because we're talking about aesthetics, okay? So in terms of, let's see, I'm gonna skip the whole presentation because there's no time, sorry about that. Next time we will invite you for sure. But the portfolio of the company covers the main, let's say the core product is mesoceuticals, like I said, is the word for those sterile solutions, and also pills and dermocosmetics. Today, I'd like to just talk about the combination that we can do with pills and meso, okay? We'll use Mesopen, Dermapen, okay? So the microneedling system for you, I mean, let's say, I think it's the alternative way that beauticians have in this country instead of injecting, okay? So obviously, I think here beauticians are not allowed to inject. So definitely, this is something that it's definitely forbidden with our products, okay? This is unfortunately, but we have those other trans delivery systems that allow you to use as well these very high concentration solutions. So let's skip on the, like I said, the core business of our company is mesotherapy with those mesoceuticals, okay? And let's talk about the portfolio, like I said. You see the mesoceuticals here. I don't know if you have a pointer, but I don't think so anyways. Here, the mesoceuticals, all here, we have them in 3 categories. We have first one, second one, and third one. If you get your catalogs for you to be able to follow that when you're at your workplace, you can open the catalog at the page, let's say, it's important. I cannot do it with one hand, okay? This page here, the one with the red points, okay? So you see, we have 3 categories of products. This page is all the mesoceuticals, okay? So you have first category, it's called classics. That means in one vial or ampule, you have only one ingredient. Let's say, imagine vitamin C, vitamin A, organic silica, hyaluronic acid, only one ingredient per vial, very high concentrations, okay? The second category, you see there is a border here, it's called BCN cocktails. So that, like the word say, it's cocktails, okay? So that means several ingredients in one vial, those are stored in vials, and that means one cocktail is for one treatment, okay? The full cocktail is for one treatment, because it's important. Why? Because if you have leftovers, you will never reach the limited amount, let's say the enough amount that you need from the different ingredients that are inside to get the results. It's important that you use the whole vial, okay? For the third category, the called advanced, those are also cocktails, and the special value of these categories that you also, a part of those different ingredients, you also have new combination and a new generation of peptides, okay? Those peptides with the combination of the rest of the ingredients will trigger the growth factors, okay? For you to have a speed off in the results. Now, very important, mesotherapy, whatever is the method of use you are doing, remember it's not only one session, it's 5 up to 10 sessions per treatment. That means that with mesotherapy, which is interesting, is that you're not using every session the same product. You can do it, but the most interesting thing is that you vary of different formulas or different cocktails. Let's say first category means that if you are already advanced or experienced professionals that you are used to do mixtures, you can definitely do your own individual mixtures, the ones that you like most, the ones that you have seen for your patients, doctor, for your clients are good and effective. And then otherwise, through Global Med, you will require a lot of protocols that have been set up, for each of the aesthetic concerns. Let's say for acne, we might provide you like 10, 12, 20 options of formulas that you can perform with those classics. Very interesting, okay? You have the volumes that you have to use, to have your combinations, and so on. So you can definitely make your own program individually for each of the clients. So that's very interesting. Remember that you can switch from one formula that you made yourself, and then second session or third session you can take one cocktail. So one session, one cocktail. Okay, next session you might be doing another combination. So please play with these combinations because you reach much better result. Like an example, imagine that I go to the supermarket and I need a product to clean my floor. Okay, I have several options. If I want to clean the floor, I might only get a wipe, and I can clean very much my floor with just the wipe. But maybe I also want to refresh the floor, or get it shining. Okay, then I take another product for that. And then maybe I also want to put a wax protection or something. And then I take another thing. It was okay with only wiping the floor. It's clean, but I can do more. So that's mesotherapy. We offer many options for you to be different with your clients and to be giving them the, let's say, the extra products or substances for they to have the optimized results. Okay. For the rest, we don't have that much time to go through. Okay, but just take in mind about these categories of mesocircles. It's important for you. The production plan, of course, is in Barcelona. We have the laboratory there. The laboratory is distributing already in 65 countries now. We have all certifications. And one important thing, why is that important that you keep on thinking about peeling as well? Look at these two biopsies, this skin. The first one is a young skin. You see the difference? The young skin, you have a very, very large dermis, okay? And epidermis. Here, when it's getting mature, all this part gets compact because there is no good renovation of the skin. It happens to all of us. And no need to be 60 years old. It already happens at 30. 25 it starts, okay? And the other thing that happens is that the stratum corneum, which is very active here by, renovation of the cells, when you get older, getting compact. So whatever you put on top will never get inside. So it's very interesting and very important that very regularly when we age, we peel off softly the outmost layers of the skin. Also, what is very important is that you deposit the ingredients that will help to renovate again the skin in this area, the borderline of the epidermis and dermis. And the only products that can reach this area is mesotherapy products. Fillers go deeper. Botox is different. So there's nothing, threads is also different. The only treatment that treats the outmost layers of the skin is mesotherapy. So the best, really, it's not necessary to go aggressive. It's only necessary to be regular on your treatments and be putting the products where you need them, okay? So let's go with, because I don't want to lose that much time, so we will skip everything. Yeah, anyways. Okay, let's go with our first patient. Hello, for acne. We are going to perform a mesopen with a combination for acne. One of the many combinations we can do with classics. You remember I said the first category of mesoceuticals, the classics? Okay, so we're going to combine, you can lie down. Okay, she is the model. Ladies, can you help me please to, so we are going to provide you, not today unfortunately, but please make this requirement to Global Med. We are going to provide you all protocols for each of the aesthetic concerns. So you can definitely play with the products as much as you want. Okay, so you please, you prepare the patient. Okay. If you want those blankets for your clinics, I mean, we have a thicker one and a thinner one. You just have to ask Global Med. Okay. We should lie down this area. I think we should lie down this. And prepare. Okay, how many of you, how many of you are familiar with Institute BCN already? No one? No one knows about Institute BCN? Who has worked before with Institute? You? No one else? It's totally new? Okay. What are the main treatments that you are performing with these products? Milano, okay, Milano for the pigmentation. Okay, Milano is a cocktail in the second category, okay, and we use it also with another cocktail if we want. There is another cocktail, you will find it in the list, called Lumen, and it's in the advanced cocktails. Those are very effective when you have pigmentations, okay. So the third treatment that I wanted to perform today was a combination of Milano and a peel, depigment and peel, okay? Especially for the areas that are very sensitive, such as underarms, the knees, the elbows, hands, also face, and specifically for high phototypes, okay? The phototypes that are high. Okay. Let's start with her. Okay, this lady, she has a little concern regarding acne, okay? She's very young, so her acne is responding to the hormonal fluctuations. So it's an acne that comes and goes and comes and goes. But anyways, we should treat that kind of things. However, it's very important, always keep in mind that for treatments of acne, you should take care about acne is not active. Let's say it's not in an inflamed let's say you have a non-inflamed acne and inflamed acne. When it's inflamed, you do not touch it because probably you have to combine with oral therapies. Okay? So let's go with her. I have to leave the mic so you hear me. Okay? But ladies, I need your help. Hello? Can you just help me with that?
الحين كتشرح لنا كيفاش طريقة نتعاملوا مع اللي عندها الأكني، يعني الحبوب والبوغاس.
We have a combination of things. We have a combination, let's say we are going to perform one combination with different ingredients, with different mesotherapies from the classic, the first category, okay? So we are going to take 3 different ingredients. One is dexpenthenol, okay? This is it belongs to the group of vitamin B. This is very good for the metabolism of, in terms of acne. It's important to renovate. Then we're going to use glycolic acid. So this will help to peel off whatever is the outmost layers, the outmost corneal sides of the skin, and to clean a little bit the too much keratin that the acne sufferers have. Okay, and then we have retinol, okay, vitamin A. So we will combine everything in one syringe. So we extract the obviously the products, and we put them all together in the syringe. This syringe will be prepared for us to perform and apply on top of the affected area, and then we go with Mesopen. Or Dermapen, the microneedlings. How many of you are regularly using microneedling? You are shy, or is just that I'm okay? So, how many of you never used microneedling? Okay, you know, I'm not Einstein, but I did maths, and I think that the numbers are not equivalent. So again, how many of you are familiar with microneedling? All of us, right? Good, good. I mean, are you all familiar with microneedling?
Yes.
Okay, that's good. Okay, so I'm not going to jump on in the details. So, very important. Microneedling goes from 0.25 and might go until up to 2.5. Okay? Please, there is no need, and it's important you understand that. I'm gonna jump into a slide. Important that you understand. It is very important that you do not reach further than 0.51. The only interest in going deeper is to break collagen fibers, and this only is when you have a scar from stretch marks or a deeper scar. I speak scars, which is not something that you don't have to tell. It's the only reason why, because there's no need to go and do blood in here, make blood. Nothing necessary. The most important is that the products arrive in the borderline of epidermis and dermis, because there is when you have fibroblasts to trigger collagen fibers, and there is where you have melanocytes to treat pigmentation. If you go deeper, you are hurting, you are increasing inflammation, and you will trigger post-inflammatory hyperpigmentation. Believe me, it's not necessary. It's not right doing that. Okay? So go only 0.51 because it's a papillary dermis. You already reach whatever is necessary, your target. Okay? So there are many misinformation regarding that. Okay? It's important you understand that, and especially because what we want is also to increase the creation of collagen. Listen, yeah, can you whatever, because otherwise, if you have questions, take advantage. No, because otherwise I'm not going to. Okay. This one, yeah. But it's right. No, this half, good half, yeah, because it's okay. Otherwise we have because I want both of them. Okay. Okay, so for her now, just your hands here and your eyes always closed. Okay. If you open the eyes, I stop. So from now on, you close the eyes, and you won't open the eyes until the end. Okay? Do you have this of all those screens that I sent yesterday? Okay, thank you. And some now, and the cartridge. Okay, so we are going to. I mean, not this one. Se bring it right. No, there's a blanche. There's a pure.
البنات الحين غادي تدينا جلسة قدامنا باش نشوفوا الطريقة اللي كتستخدمها بخصوص اللي عندها الأكنة.
Like it is. Okay. Okay. Please ask questions because this is something, a procedure that you might be already doing regularly. I just want you to understand that we can do that right after I'll perform a deal. Okay? So, because this is something that you might be, if you want to come here, if you want to ask questions, do not hesitate because it's your time. Okay? Now, I want you that she doesn't open the eyes. You don't have any towel, something to cover.
Excuse me, if you have any question, you can ask her it now. She is ready to answer any questions from you while the session, during the session.
What is the point? What is the point? I have a question. No, open the eyes, huh? No, open the eyes. Oh, I will change the movement now. Yeah, have your question.
Yeah, I was asking because I saw you.
يعني بدون مخدر والله
No. Go ask
شو
the
تشتغل
question
على
with your mic. Yeah, with the mic.
بدون
Yeah,
مخدر شو
مؤلم
مالك
ولا ايه ولا دخل شفايفي؟
tissue.
دخل شفايفك
We need a towel. We
Yeah.
need tissues. We need.
Yeah.
It's important.
I have a question, please.
Yes.
I have a question about the movement. I saw you like making tapping or vertical lines.
Good question.
Usually you do the dermabn with round movements.
Okay.
What's the difference of this and what do you prefer for this treatment?
Listen, if you see in this area, in the area that is most affected by scars, I'm doing tapping. Obviously, I started first with 0.25, but I increase step by step. When I'm doing 0.25, I can do it by circular movements, or please take care about she's not touching the skin. You can do circular movements because it's not enough deep, and you can definitely do that on top of the skin without hurting. When you increase up to 0.5, normally it's better you do tapping, okay? Because the needles are going too deep for the skin not to be scratched, okay? And when you scratch, you are hurting the skin. This is not what we look at, where we are looking for. We are just looking for to make micro holes to be able to penetrate the product deeper in the area that I have shown to you. For the ingredients to be ready to be active in the area that I have said, okay? So also when I have the area with these scars, if this was a patient with deeper scars, not too close, sorry. If this was a patient with deeper scars, I would have put it a numbing cream, okay, and go even deeper, maybe even deeper than 2, 1.5. 1 is okay because the body is 2.5, but for phase 1, 1.5 is really fine. And I hurt a little bit more. Now, no need, okay? I just want to increase and to put the product inside very deep, okay? So that's my point. That's why I was changing, because initially I started by doing circular, which is much more comfortable for the patient, and then tapping is something that they feel more. But it's more interesting for me to be sure that I'm just doing on this area, you know, a little bit the holes where I go a little bit deeper. Is it clear? And you will see that when you reach up to 0.5 and you overcome 0.5, and normally it's not easy to do circular, and it's not recommended because you will hurt the skin. Okay, it's not what we looking for. Okay, we're going to do the other area. Okay, okay.
0.25 هذا ربع.
Yeah, but no necessarily.
ربع بالمخدر عادي حلوة.
That's no, because she doesn't have deep scars. Like, for example, if I can, for example, you like me, and I have sometimes it's not necessarily go deep. We should only go 0.25.
About patient has score, deep score. Using this combination.
No. Then yeah, sure, we can use this combination. Yeah.
More than
Change.
1.5.
Can you change the? Okay, sorry.
More than 1.5.
No need. I mean, you can go one first, and then you will see. It's better to. No.
In this side,
She's so stressed. I mean, sorry about that.
I will make it.
No. Listen, don't be stressed. I'm doing exactly the same. Okay, close the eyes, but I'm doing exactly the same. I'm just talking with them, but I'm really
I'm not stressed, but I'm not opening my eyes, so I can't see what's happening.
No, it's you don't have to see what happens. You said you were trusting on me.
Yeah, sure.
Okay, so this is only the product.
بدي تشوف شو بصير. ما في شيء قلنا.
You know what I mean? You move the face and it can hurt you. You know what I mean? So it's better close the mouth so it doesn't get inside. I understand it's complicated because we're speaking and it's not quiet. But believe me, we are just then you can look right after. But now I prefer that you stay without it. Okay?
Can I inject it?
No.
Only for dermabend.
And you won't have good results by injecting them. Believe me.
Generally, I'm asking generally to know everything about products.
No. No, only doctors. Oh, she's a doctor. Please, sorry.
يعني النوع من الميزوثيرابي هذا ما يتحقن، بس نشتغل بالدرمابن مايكرونيدل، بس ممنوع ينحقن. في نوع انه ينحقن وفي نوع ما يتحقن. بس هذا النوع للاكني بس نشتغل به بس بالمايكرونيدل، بس ممنوع نحقنه.
Obviously, but here the point is like just because she's too nervous, I'm just doing 0.5, 0.25 because I mean, you don't have towels for her because I feel bad that I'm yes, and that's why I'm not working comfortably. I do not work comfortably without this. Yes. You okay? Okay. It's not hurting, huh? So now I can do sweeping movements. Okay. No, it's not hurting. It's just the sensation. I know, but I didn't change anything.
المهم الخلاصة اللي استفدنا الحين من الميزوثيرابي في نوعين، في اللي ينحقن وفي اللي ما ينحقن. النوع اللي ينحقن يشتغل على داخل تحت الجلد، يعالج مشاكل تحت الجلد واللي فوق، واللي سطحي يعالج بس مشاكل السطحية. بس الديمو الحين اللي سووه الحين حق اللي عندهم الآثار حبوب وحبوب، يعني يعالج الآثار حبوب بس سطحي. بس المايكرونيدل احنا ندخله من برا صورة.
What's the possibility of having an infection?
Like I said at the beginning, whenever you have inflamed acne, which means that you have used to pause. You cannot touch, you cannot do microneedling because you spread the infection. Okay? But this patient, like many others, they only have comedones or they have scars, post-acne scars. Then you can treat with this. This is not inflamed. No need. You see you can see it visibly. Can you see
يديروا لها
inflame means when you have
كيديروا لها شو اسمه المايكرونيد تبع الآثار حبوب واللي عندها الأكني اللي عندها الحبوب.
It's just comedones, open scars. This is not active acne, and she needs probably oral treatment first to minimize the infection, okay? And then when the infection is controlled and you don't see pus, okay?
لأنه هذا
Yes, sure, of course, like I said at the beginning, this acne is, let's say, it's responding the normal hormonal okay?
الدعايات كتبان راهي كبيرة صغيرة كلهم ولكن الدعايات كتعرف كيفاش توصل. هي راه كتقول هذاك الشيء عادي كاع عارفينه ولكن طريقتها هي الطريقة اللي تلعب دور. أنا عندي سميتو قناة في اليوتيوب كنقلب نهضر وكندير كنصور الدعايات كنروح لي شي جهة. أول مرة جاتني صعيبة. الأول جات صعيبة بعدين صافي تعود. مع الممارسة صافي. هو يوم على يوم. هذه عندها آثار حبوب وعندها حبوب. اوكي هذا مش بيلينغ اللي دار فيها بس بيلينغ بس بطريقه وغيقشر لها بس غيقشر لها شي بسيط وغينشف لها الدور مزيان ما عندهاش عندها بس اثار عندها شي بسيط منها اثار المفروض يديروا الكاميرا عليها وتكون تما. الحالة هذه مشكلتها انه عندها اثار حبوب وعندها حبوب كتخدم لها تقريبا بس بالربع يعني بشيء خفيف وحاطه لها احماض فواكه وريتينول. صباح الخير. فهذه ممكن تحتاج كل شهر جلسة لانه خفيف 20 يوم. هو من الاخر كوزميلان كاين هذاك افيكاس عندك كوزميلان والثاني سميتو جرين بيل فيتامين اي والفيتامين اي خدمتي بالفيتامين اي عجيب ترى هو الكوزميلان اللي ما يعرفش يخدمه راه تحرق الواحد كيحرق الواحد وكيرجع البيجمنتيشن خصك توقفي ستيب جاتنا حالات محروقه حيت بحال اي تقشير ما يمكنش توقفيه اي بيلينغ خصك ديريه مره واحده تهيئي البشره في نفس الوقت توقفيه وبخطوات.
Is very good for the acne prone skins or the oily prone skins as well as mandelic that for oily prone skins helps also because of she has pigmented scars which is normal. Mandelic will help. Okay, so on top of this very mild microneedling process we are going to apply a very mild peel for her to have a complete acne session treatment. Okay, and it's important we understand that because acne is very fluctuant in manifestations, there is no sense to use always the same combination like one cocktail, because for acne precisely you need to change your formulas. Okay, if you use always one cocktail, it's okay to use it once in the treatments, but it's better you change for acne, specifically for acne. Okay? Now we are going to proceed to apply the peel. Are you okay? Those are the acids. They're very soft, buffered. They're very soft. They're buffered. Okay, so no worries. Salicylic is an acid that already is neutralized by its own. Okay, so actually we wouldn't need to apply on top a neutralizer. However, we do have neutralizers. Okay, just in case of the patient feels uncomfortable in one moment. They're extremely soft, so there's no risk. However, it is mandatory that before and after there is no direct exposure to the sun. There is no direct exposure to the sun. Otherwise, they can have a rebound pigmentation. Very important, especially in this weather and with your photo skin types. Is that clear? So let's proceed. I have a goal. We can use also a base, and we can use as well. I like to use a gauze because a brush, if I have performed
شوية نقربكم للخاتيك.
For me, the brush, I don't know if it's really clean. Okay, I'm not sure. So I always use the gauze, or otherwise I use my gloves and I put it on my gloves and I just cover. I will do one side with my gauze and another side with the. So this is, you see a pipette. So I embedded the pipette and I proceed. Always when we treat with acids, is from inside to outside. Always. It's okay. Yeah. It's a concentration of 2 acids, okay? You have 15 salicylic and 15. But it's important that not the concentration, but not the concentration. They're buffered, of course, like I said. It's important the pH. The pH is from 1.5 to 2.5. Yeah, it's okay.
She feel burn, little bit burn.
بيحرق؟
I cannot
أكيد
have
أكيد.
everything, either one side, either another, because otherwise, sorry.
أيوة بردي عليه. وشو بيصير بعدها؟
هي هذا تريتمنت للأكل.
So we leave it for a few minutes, okay? But you see, immediately it's absorbed. Why? Because the holes have allowed to penetrate the acid first. Of course, I can do another layer if necessary. For example, in this, let's do it in this top front for her to have an extra. Because here we haven't done the microneedling. So you could definitely do it.
بالعكس أكبر من نجيبه اسمه.
Try to skip the areas when you make a peel, of course, because we don't have time, we don't go through the whole protocol, okay? But remember to cover areas such as, for example, this area. This is a spot that has a little pause, okay? This was probably infected 2 days ago. I have kept this, okay? I didn't touch. If I had a little bit of Vaseline, I would cover, okay? But of course I would cover the eyes, but I didn't area.
Skip it from the peel.
No, exactly. Okay. So but however, with this patient, I didn't very much go narrowing the whole face. I just focus on the areas affected. Okay, and I did the forehead just because she has these little pimples, normal pimples. Okay, so it benefits from a little bit of. Okay, so that's it. Do you have yeah, water with 2 wipes or something that I can do?
لا كزيناها
I she has no or I can do the peel. The peel I can do it on top of no problem. Very mild peel I can do it. But without dermatologist. No. Oral is just dermatologist will tell. So if you see a very active acne, you go and see the patient going to the dermatologist. And the dermatologist is providing probably oral therapy. And then they come back, but you need to treat the skin. Again, remember what I said, the skin, you need to renovate continuously the skin, no matter if it's for aging, if it's for collagen tightening skin, if it's for wrinkles, you need to constantly renovate that. And for acne as well, because they have hyperkeratogenesis, okay? So those blackheads that they have, these pimples with the blackhead, this black is not dirty, it's keratin. It's extra keratin, together with extra sebum. This is a problem in the pilosebaceous gland. So for an acne person, it's very important you constantly renovate. And again, I'm saying it's not really the point to use only the same cocktail for acne. That's why we didn't make any cocktail. Because what you need with acne is to constantly change your protocol. Okay? Okay, let's go with the wipe.
water.
Okay, they don't have wipes, so let's do it with that because, sorry, otherwise, I don't know what time is it, but I don't want to lose time. Thank you for the questions, by the way. I know, where is the lady? Thank you for the questions. It's much, okay? So like I said, for salicylic, the neutralizer is not necessary because the salicylic neutralizes itself. However, we will do it as well for you to see how we use it, okay? Now the patient, when I put water or the neutralizer, momentaneously, she might feel even a little bit of burning during 1 minute extra. She says yes. This is because the pHs are getting unified. I have applied a pH acid, and what I'm putting with water is a basic thing. So we balance them. If water is pH 7, the acid is 0.5, no, it's 1.5, 2.5. So obviously this is starting balancing. So it feels like effervescence, but it's gone. Eh? So it's 1 minute and that's all. When I put let's say in this area, I'm going to use the neutralizer in front. Sorry? Ah, okay. Yeah, I don't understand. Inshallah. Yeah, good. She's good, huh? What is it? It's new and it's...
Yeah, it's new. Give me
I'm
the
burning right here.
It's normal, you're burning. But you will get very nice. Actually, okay. We, right after... No, remove the... Let's we don't have time. It's okay. Okay, neutralizer. Close the eyes.
Okay. Burning, huh? Okay. That's what I want. Burns. Remember what I said, always from inside to outside. Like if it was a wound.
You want more?
No. Not more. I want someone opening
The hyaluronic?
the hyaluronic, but
Yeah.
opening. Okay. Good girls. I have a good team.
شاطرة شاطرة.
You okay? Was not that capital, huh? Means no? Means yes?
No.
But you have to undergo this a little time, huh? You will be pretty. More pretty than what you are. This is nothing. Okay. Now, after any peel, after any session like we did, what we can do, I have to go quick. Okay. So after we have these ampules from the classics, from the first category. Remember, we have hyaluronic acid. In this laboratory, we offer 3 references. Listen, listen, ladies, because it's the group. That's why I'm saying it's the team. I want them to hear. The team, I want them to hear. We have 3 categories. And we have in the first category of mesoceuticals, we have hyaluronic acid, 3 references. This one that I'm using as a mask, okay, it's 3.5% hyaluronic acid. That means that we have 35 milligrams per ml of hyaluronic acid. We have 5 ml in this vial. So 35 milligrams per 5, it's a lot. So we take advantage of that sterile product. So in any procedure that is aggressive or let's say, I don't know, we have a good benefit. I'm going to, this is very nice, but because I don't have time. Okay. This is too thick for that. That's why I didn't.
We can open
Get my one. Okay, the 2%. We have 3.5. We have 2%. If we have. And we have 0.8. Okay. If it's too thick, you don't put it here because only the 0.5 or give me the vial. Is there any more?
this one, yeah. It's already like this.
Oh, can you open please, because I cannot. Okay, so we put this as a mask. We leave it for 20-15 minutes. This is kind of covering the skin that has been treated in a sterile way. So it's much better than if you put any mask, because when you do, a micro needling, remember you open vials. This is something that can be, sorry about that. This is a way of a via that can be infected with anything. Maybe the lady that has been treated has her kid and the kid is just touching with the hands. This can be enough. Yeah, I know, but you don't have the spatula, the little spatulas.
This one you can use this one.
Why didn't
You can use this one.
No, why didn't you take the 2%? Because otherwise we have to extract it.
We can make it with dexamethasone like that to make mask.
This is not a little spatula. That's not really professional, honestly. We lack a lot of things, but no. Yeah, but it's anyways. It's the same effect. Then here the leftovers you can mix with dexpantanol. Can we
No,
mix? Can you
dexpantanol.
mix the leftovers of dexpantanol?
Yeah.
You mix it with that, please. There is a leftover of dexpantanol. Can you mix it with that, please? You see, it's kind of a gel. You feel okay? Now it's much better. Huh? Doesn't burn, huh? And it calms. Like she says, it calms. Now, what is for her the next step? We remove the mask in 15 minutes, okay? And after the mask is removed, we apply sunblock, no matter if it's night outside, but the lights, the neons, everything is affecting, okay? Once she gets home, she can clean up her skin, just normal as usual, soft. Maybe she doesn't need to clean in the evening right now, today, but she can use any soft cleans. We have the BCN cleanser, it's not here, unfortunately, because and then we have Mesopure as well, it's not here. We did it yesterday, but it's unfortunately recalled. Anyways, we have these creams that I told you. Oh, the screen is gone. Okay. We have specific cream for acne, Mesopure, okay? Mesopure has to be applied daily. On those patients also, especially after peeling, you must apply sunblock, okay? And for every day, she will be using Mesopure. If she has an area that is specifically dry, she only uses Mesopure in the area affected of her acne, okay? And the other areas, she might be using, for example, the T-zone and this area, Mesopure, and on the cheeks, if she doesn't, if she uses any other moisturizers that she likes, okay? On top of that, when she goes out, definitely, regularly and several times per day, she uses sunblock, okay? So this is for her. Thank you very much. I'm going to make you leave the bed because I have someone else going to the bed. But no problem. You can stay. Keep this for 15 minutes and we'll remove that with some white water, just water, and we'll apply the cream. Okay? Thank you so much. Wasn't terrible, huh? We will repeat that, huh? Inshallah.
Thank you so much.
Thank you. Okay, so next is the Aifent.
المهم البنات الخلاصة تاع اللايف اللي حطيت لكم للتريننج هذا هو انه لحظة شوي نشوف بس شنو ممكن تدخلوا عندي. خلينا أول شيء يدخلوا بعدين يصير خير. أول شيء خلاصة التريننج اللي سوينا الحين إنه يعني كيفاش نعالج الأكل، كيفاش نعالج الأكل المايكرونيدل والميزوثيرابي بس عن طريق الريسبي والعمود. بس إن شاء الله تكونوا استفدتوا. بعدين أشرح لكم من الأول للآخر.
This is a mesotherapy treatment as well, consider, okay, because we use the mesotherapies. I said, first session we can do that. Second session, maybe if we only do meso with another combination of products. Fourth session, maybe I only do the PEEP without mesotherapy. Fourth session, I combine both again. So the most important with acne is not to do the same every time. And look at the skin. How is the skin getting? Sometimes it might be, the lady is not here. No, it might be that it gets worse after a treatment. Why? Because you have stimulated the skin, and the skin, the problem, that the acne that was deeper, because you increase